So today is the hearing of Senate Bill 143, which is to establish the infrastructure for distributing medical marijuana in Louisiana. I think this is a very important issue, especially for everyone who with any type of brain injury, particularly. A lot of brain injuries are easily preventable, the current research shows, with cannabinoids and reversing the effects as well. And so this is the kind of thing that when growing up, it never really seemed like there was ever going to be any type of option available. But now it looks like I could actually make a full recovery, and that's just awesome. And so I'm here to stand up for that, and that's what the research shows, and I think it should be an option. I think it should certainly be in the discussion. And furthermore, the original medical marijuana bill was passed for spastic quadriplegia 1 year before I was born, and there's promising animal data, at least, to show that maybe if they had given it to me when I was that age, that I would have never actually been disabled at all to begin with. So I think that, this continues to happen between 2 and 9 live births per 1,000. And this is terrible. It's the #1 cause of permanent neurological deficit. And so I'm just going to keep talking about it until something gets done.
I'm here to support Senate Bill 143 by Senator Mills. It establishes the infrastructure for medical marijuana distribution in the state of Louisiana. Currently, medical marijuana is legal in Louisiana as per a bill passed in 1991 under Governor Edwards. However, the Department of Health and Hospitals never promulgated the rules and regulations for distribution of it. So although it is legal in the state, there's currently no way to legally access it. It's an issue for, all patients across the state, citizens in this state that can benefit from it. We have people with a wide variety of illnesses, some that have testified today, and it's been demonstrated in 24 states now that have legalized medical marijuana that it can have some serious benefits for them. So we're here to, let their voice be heard and hopefully get some care to them.
How do you think that this would help you?
It could cure me. I have epilepsy, so I'd prefer to treat it and get over it. And I'm tired of taking a medicine that toxifies my liver and makes me constantly tired. Just want to speak to the Senate committee, and I want them to understand that I'd like to have options with my medicine choices. My name's Matthew Duyon, resident of Baton Rouge for the past 25 years. And I have epilepsy. I have clonic tonic seizures and juvenile absence epilepsy, and I should have grown over that, but I have not. I've been taking a medication called Depakote, divalproic sodium. Actually, it's something her daughter takes, and it's changed completely who I am. It's made me into a dull person, and I've been like that since I was 15, and I haven't changed since. I've worked my ways around the medicine to function in life as a daily citizen, and I've done decent, but it's nothing compared to what the possibilities are available if we were to consider medical marijuana. And I've been through a cocktail of medicines myself, and I can't remember 2 years of my life from the cocktails of medicines I took. And I talked to my doctor recently about getting off my medication. I did a study, and she told me that I still have abnormal activity in my brain. Even though I'm taking this medication, it's just the best thing for me, it's not. It toxifies my liver, and I have to get blood work done twice a year. I don't want to die young. I love my wife. I love my family. I'd like to stay in this world as long as I can. And it scares me. I almost broke down just hearing that. So I'd like to have options. I'd like to be able to choose other things that are possibly better for me, and I'd like this to be passed. So that's all I have to say. Thank you.
Thank you for your testimony.
I personally, I have a spinal cord injury, and the main issue for me is, I've actually tried it, and I've experienced nothing but benefits from it. And the other drugs that doctors actually prescribed me had terrible side effects for me. And the antidepressants I was on never made me happy. And when I, experimented with marijuana, I was happy. And And I also had nerve pain and spasms, and that relieved my nerve pain and it reduced my spasms. Unfortunately, I don't smoke. Haven't smoked in a while, in over a year, because I'm in grad school and I work in a medical setting. So there's always the potential of being drug tested, and I have no prescribed prescription from a doctor saying that this is recommended. So, and currently I'm experiencing nerve pain from my neck and shoulder, and my spasms are terrible. So this is something that would benefit me. That was actually my way of getting off of everything. I weaned myself off antidepressants because I did some research and I didn't want to mix the two. And I stopped taking my opiates for pain pill or pain medicine, and the worst part about that was the addictive dependency that I had on them. I've never experienced that with marijuana. My name's Tommy Mead. I'm a student at LSU Health Science Center in New Orleans, and I've lived in Louisiana for about 10 years. I have a spinal cord injury, and I suffer with muscle spasms, nerve pain, and joint pain, and trouble sleeping at night. When I first was injured, I was on about 22 medications, and by the time I came home, they had me on about 8, and a lot of them were narcotics, which is why I'm in the field I am in now, which is clinical rehab counseling. And luckily, I was able to stay away from the narcotics, but I suffer with a lot of pain. I have trouble sleeping at night, but I push on. I didn't mean to get emotional, I'm sorry. And this is always something I've been aware of, but I know that the infrastructure isn't permissible for me to take medical marijuana. And I just want to tell you that I appreciate y'all considering this bill. And I know a lot of people have worked really hard and networked together to get this on the floor. And I just want y'all to revert back to your caring ways on the bill that was on earlier. It's about caring for patients in Louisiana. And so thank you.
Thank you for your testimony.
I'm a spastic quadriplegic as a result of a stroke when I was a kid and oxygen deprivation. They generally call this type of thing cerebral palsy. That's the common overlapping class. And so marijuana has 2 different components in it that are very good for this. Number 1 is cannabidiol, or CBD, which has actually been shown to reduce the effects of necrosis and actually restore blood flow to different areas in the brain. And then in addition to that, it's also good for preventing the further side effects of stroke, so it's a preventative measure as well. For the spasticity itself, that's the result of the stroke and not getting cannabinoids originally, the CB1 receptor activated by THC actually helps regenerate 2 different types of nerves that produce myelin, and thus insulate nerves and eliminate spasticity. I took medication for a number of years, probably about 18 years. These days, I just handle the situation myself, and I've been improving substantially, actually. It's been getting a lot better. I was in Colorado for a while. That was nice. It's just looks like here is going to be able to place where I'm going to be able to walk and live and legally, and that's great. Those are things I really like.
Currently, over 200 ailments could be helped, but the bill obviously doesn't address all those. But some of the ones I think it's most beneficial for would be spastic disorders, quadriplegia, epilepsy, AIDS wasting, cancer, chemotherapy effects, and some of the negative things that result from chemotherapy.
My name is Michelle Hall. I come from Vernon Parish, and I bring you my little girl that I've adopted from the state of Louisiana that has severe epilepsy. Medicine is not going to stop her seizures. She goes 4 to 5 months. She starts seizing again. We're in and out of the hospital. These are her medicines that she takes every day. This is her everyday cocktail I have to give her. We start with Depakote. 500 milligrams of Depakote this baby takes every day, twice a day. Then we go to triliptal. She takes 10 milligrams of this every day, twice a day. Because of these two medicines, she has behavioral problems because she has a reaction to the meds. So then we have to go to Prozac that my baby takes right at 4 milligrams a day. I have to give her Prozac. That's not enough, so we have to go to Risperidone. My baby takes this every single day. She takes this just to get through a day. Sometimes we don't make it through a day. She's like a 3-year-old colicky baby some days because of what I have to give her that doesn't fix her seizures. It just tones them down a little bit. And because of all this, she has reflux. So if anybody's ever had acid reflux, I took her and had a sleep study because she wasn't sleeping good. There was a lot of issues. She failed her sleep study. She has sleep apnea because she's gained over 20-something pounds in 1 year because of all these meds. So she has issues sleeping. She has reflux, so she has to now take Zantac. Getting Zantac was an act of Congress, literally, because Medicaid doesn't want to pay for some of these medicines. It took me a week and a half, and if anybody has acid reflux, that is a horrible thing to have. And I have Medicaid standing there telling me, sorry, can't fill this, find another one. Sorry, can't fill this, find another one. My 4-year-old suffers because some of these meds I have to pay out of my pocket because Medicaid refuses to pay for it. Getting her into a doctor's office, that's another joke. I'm trying to get her into New Orleans because they want to do studies to see if she even qualifies to have brain surgery. That has been going on since February. Medicaid says no. New Orleans says it's a 5-year waiting list. We'll send you to Dallas. We go to get authorization. Sorry. We can do it here. So we're back and forth. Well, my baby suffers with seizures, behavioral problems, and I went to Colorado because that's my last-ditch effort. I don't know what else Louisiana can help me. So I go to Colorado, and I go up there, and I'm having to turn over my rights to be Louisiana residents because I can't be here with the medicine. My husband works in the oil field, so he has to stay here. So I have to leave my family, everything behind to save my child. And that should not have to be. So I have to go, and this doctor's telling me that by just taking 0.25, I can do away with this medicine, automatically day one, it's gone because that cannabis oil, 0.25, is going to stop that. And it's going to work on those seizures, and they'll start weaning her off this other garbage. And she would be a productive adult without any of this. And you can't kill her on the cannabis oil. I could kill her on this cocktail I feed her twice a day. I could kill her. I spend my days trying to protect that baby girl that I would give my life for. And I'm just asking you to please consider what it is we're asking for. It's in its purest form. That child will not get high. She will not have discomfort. She will feel a life that she probably hasn't felt since she was a year old. She had her first seizure 3 years ago. And that was the beginning of a horrible nightmare for us. Like I said, I adopted her from Louisiana. And I'm hoping Louisiana can continue to help me take care of my baby here and not force me to go to another state that I have nobody there. It's me. I have to take my 6-year-old son and my 4-year-old daughter and leave my parents, my husband, all my resources to a whole nother state where I have nothing just to take care of my baby. But I'm willing to do it. But I'm begging you not to make me leave my home and my family. Or to grow up without her grandparents. You know, I'm begging you to at least let this come out of committee and let's work out the details in other ways. But this is important.
Thank you for your impassioned testimony.
Besides the medical benefits, socially too, this is something that I've personally been stigmatized because I've said something like this and people have, considered me a bad person or evil or a convict or something. And I try my best. I've accomplished a lot, and just because I want to cure myself, make myself feel better, it doesn't make me a bad person because I choose this other method that benefits me.
The bill passed unanimously in committee today. The next step is it will go to the Senate floor, and after that it will go to the House committee in its amended version, the House floor, and hopefully the governor. You can check out our website. We're with Sensible Marijuana Policies for Louisiana, and you can check out our website at simplelouisiana.org. This is history in the making. This is a historic day for the state of Louisiana.